Well, the Medicare Safety Net is really was the first major change in the social insurance arrangements for Medicare in 20 years. So it was introduced in 2004, and prior to that, basically Medicare just pays a set amount per service. So you go to the GP and Medicare will reimburse you a set amount, and whatever the doctor charges, you have to pay the out-of-pocket cost, or you have to pay the difference between what the doctor charges and what Medicare pays for you. The safety net changed all that. So the safety net now all of a sudden, once a family reaches a threshold in out-of-pocket cost, once they reach that threshold for the rest of the calendar year, the safety net actually pays 80% of out-of-pocket costs. And so that's a pretty big change. It's reasonably hard to qualify for the safety net, so only about 1 million people out of 23 million qualify for the safety net. But for those million people, it's an important piece of legislation, or an important change, because they're now covered by 80%. And that's really the biggest motivator for us to start researching this, was that change. What impact did that particular policy have on the access of care? How do people change their use of the healthcare system, as well as what happened to doctors' fees and what happened to government outlays? Our biggest finding of the research was that the prices for a lot of medical care services went up, and they went up significantly after the introduction of the Medicare Safety Net, particularly in the area of private obstetrics, IVF, as well as a certain small number of procedural types of things. And that of course meant that when the fees go up, it means that a lot of the government benefits that were meant to go to patients actually went to doctors. Now, as far as the impact of our research well, we've had various pieces of research go into the sort of political process. So we did 2 reports that were tabled in Parliament. The first report was actually incorporated in the 2009-10 budget, and the 2011 report, also tabled in Parliament, is still being sort of filtered through the government cycle of legislation, etc. The other part of the impact of the safety net was that when you change social insurance arrangements, you want to make sure that those on the lowest incomes actually benefit the most, because they're the ones who have financial barriers to getting access to the healthcare system. And what we found through the safety net, though, is that maybe that was the intention of the policy. The unintended consequence, in fact, was that the benefits went to the wealthier groups. So wealthier people living in wealthier areas were the greatest beneficiary of the Medicare Safety Net. And that's because they're the greatest users of specialist services. And specialists are the ones where the fees are much higher than what Medicare actually pays back. And so they're the ones who naturally benefit from the policy. And that was really an unintended consequence, I think, of the policy itself. Well, I'm very excited that just in the last few weeks we were the recipients of an ARC grant, which will follow up on the work that we've done on the safety net. We want to revisit some of the issues that we did previously, because we have better data, new data to work with. There have been some minor changes to the safety net policy along the way, which we can investigate. Most importantly, we want to investigate this from a sort of social insurance perspective. And that means that we want to look at what happens to how different people, how different groups in society respond to a social insurance change. Do people do people know about it? Do people use the system in an effective way, or are there other groups who are not being able to use it in an effective way?